This is Hannibal from thehannibaltv.com, and today we have a unique guest, Dr. Tony Osio, who was the physician of former world champion boxer, who was also an actor in Rocky V, Tommy Morrison. How are you doing today, sir?
I'm doing very good, thank you.
As far as your medical background and degrees, could you tell us a little bit about that to start off?
Yeah, I went to medical school in Colombia and I graduated there in 1965. I did my initial training in OB and GYN in Colombia. But when I came to the United States, I was involved in the internship that I had to take in order to get a degree, a license. And during my internship, I passed from OB and GYN to all kind of medicines. And I got very interested in general medicine. And in the hospital that I came here in Wichita, they were starting a program that is called a family practice program. And I was the first resident who enrolled in the program. Uh, and the rest is history.
I understand you have permission from Tommy's widow, Trisha Morrison, to discuss his medical history with me today.
Yes. Uh, they came in here. Before they came in here, I was involved in boxing. I was assisting amateur boxing here in Wichita, Kansas. And when they came in here, somehow they got my name, and because Tommy was trying to organize things here in Wichita, I think that he was organizing a boxing club or something. Uh, then they got my name, and he came to my office to see me for his general condition. He was very good. When they came in here, one of the things that they told me is that they had been diagnosed with AIDS. And I was really surprised because he looks so good. He don't really looks at all like he have AIDS. And I laugh about it. They say, well, I mean, if they diagnose you, I suppose that they diagnose you. But in the next few visits, they explained to me how the diagnosis was made, and it doesn't make sense. Uh, he, from the moment I saw him, I started giving him the thing that he needed. He was a sport provider and performer, and he's a heavy sport because boxing is nothing easier. And he was uh, in need of supplements to keep his body size, and to keep his energy, and to keep his mind clear. And he was, of course, full of aches and pain because in his job you had to. And slowly for surely, I got to know him, and then he told me the history of who diagnosed and how he was diagnosed with AIDS. And I told him that doesn't make sense. You don't look like you have sense. I mean, by then, in that time, 94, I think it was, we used to have, I have seen several patients with AIDS, and he didn't look at all like. And we decided to have him tested, and I tested him in the lab that we send the things from here. At that time, from here, we send it to a lab outside town, and the report was negative. Say there's no AIDS. Say, well, okay, then we don't have to worry about any extra measure. And I treat him never like a patient with AIDS.
Would someone that's not a physician be able to tell if Tommy has HIV or not?
Oh, I was at that moment very aware of AIDS. I have multiple patients. I have seen several patients, and the only thing who was in favor of AIDS for Tommy was what they had been told him and his wife. That was the only proof that he had AIDS. And I was, as I say, I was very skeptical. I talk about his case with some of my colleagues, and they all laugh. They say, "Who knows? There have to be some mess up there in Las Vegas. They want to get rid of him or something, but he doesn't look like he has AIDS."
Now, you mentioned that you prescribed him some medications, and in your affidavit, which Tommy's widow provided to me, you actually talked about some of those medications. Could you tell us about some of the medications you prescribed to him? I know
Yeah,
Adderall was one of them.
the most common medication that we had to use to him was supplies on cortisone because in order to keep the muscle size that he have, you have to get some stimulant, and we provide those stimulants who are cortisone. We give him cortisone injection. We also give him a lot of vitamin supplements, especially vitamin B12, because he needs that to control the pain and discomfort that he was suffering all the time. Because of the pain or discomfort given to his specialty, punching everybody and being punched by everybody. From time to time, he needs to have some pain medication, and we provide that for him. But all that was part of the spectrum of treatment that a boxer usually has.
The Adderall would have been for some mental health issues because I think he had a attention deficit disorder.
Yes, mostly because of the situation that he was in, and he was hyper all the time. We need to calm him down, and that was the reason for the Adderall.
Now, I understand you were also a ringside physician as well, so you're aware of the health that someone has to be in to be approved and endorsed medically as a boxer. Did you see any reason why he shouldn't have been licensed to fight anywhere in your time treating him?
Well, as I told you from the beginning, I was really surprised that they banned him, or that they told him he cannot fight because he was in excellent shape.
Now, there's a lot of people that will look at pictures of Tommy in his later years when he was suffering from other health ailments that we'll get into, and they'll say, well, look at him. He clearly has AIDS. Could somebody tell just by looking at a picture of somebody whether or not they have HIV or AIDS?
No. HIV is not a condition that is diagnosed by looks, because there are some other conditions who make the patient look even worse than them. However, the definitive diagnosis is the blood test.
I understand he had an insect bite during the time he was in prison that caused him some very serious health problems. Could you talk to us a little bit about that?
That's what he led to his end, because initially he came in here with a little bite in his shoulder, and we saw the bite in the shoulder, and we immediately started treatment because of the other treatment that he was taking. He was taking prednisone, and patients who take prednisone are more sensitive to infections. Then we started the treatment for him aggressively with antibiotics. We opened the sore, and when we opened the sore, we realized how serious the problem was. I informed him and his wife of the condition, and they immediately make arrangements to go to a place where they receive treatment.
What kind of insect was it? Did he ever know, or was it just a random insect?
Well, when I saw him, it looked like an insect bite, like a spider bite. That's the one that a spider bite looks like. And we could not figure out what other kind of bite he got. But again, you have to keep in mind that he has this cortisone that he has been taking for a long time to keep his muscle functional. And because of that, the infection was so dramatic, so severe, so extensive, to the point that when he got to the place where they choose to go, they find out that he have an infection who needs to have massive surgery, and that's what he got. He got an intense surgery. They clean him up. They fix him up as best as possible. And he was in such a good condition that he healed perfectly. Perfectly, because the scar that he have after the surgery, I saw the pictures. I didn't see him. But the scar that he have after the picture were completely normal scar from any regular surgery. That was what he had to clean the abscess.
ESPN did a documentary about Tommy Morrison, and I'm wondering if, as his treating physician, if they ever contacted you to be a part of this documentary that they did.
Never.
As a ringside physician and being aware of Tommy, are you familiar with Don King at all? And if yes, what are your thoughts on Don King?
Yes. More of the information that I have from him is from the news. The news say that some news say that he's a wonderful man. Some news say he's not. I know that he is a man who has been in the job forever, and I think that he still is in the job. And I don't know. I don't want to make any comments about him because I don't know him personally or have not been involved in any of his business.
Now, you did sign an affidavit for Tommy Morrison. Would you mind reading some of that affidavit to us that is part of the court records? I think it's about 2 pages long.
This affidavit and say that Tommy Morrison, with the date of birth of January 2nd, 1969, was seen in my office on September 29 of 2011. He had a large abscess to his right axilla, which was a result of an insect bite, probably a spider, that had occurred a few days prior to his visit on the 29th. It was necessary to drain the abscess at that time, and if you require further additional information, please do not hesitate to contact me.
Thank you. I appreciate that. And is it correct that you were sent the anther mortem from Boston in 2012?
As a matter of fact, I have a copy here.
Was there any evidence in that report that he passed away from HIV or AIDS or had HIV or AIDS?
It cannot be because he didn't pass away from HIV. And I have the proving here that he didn't. And that's the University of Nebraska Medical Center. And as a matter of fact, I had the initial report who was doing several years before that Tommy Morrison had no viral inclusion, no fungus, or no bacterial form are identified in his blood. The post-mortem report is from Nebraska.
Okay.
The pre-mortem report is from Massachusetts.
Okay. So what was his actual cause of death?
The cause of death, I know that he died of a massive infection, but the final surgical report of the death, he said that he have in the blood, he have a monocytic cell consistent with peripheral blood with fluffy coat layer. No viral particles were seen.
So was that infection caused by the bite?
The what? The infection, yes.
Yeah.
Yeah. That was for the infection that he had in the bite that I originally saw him and sent him to be treated for.
Could you share any of your experience of what he was like as a person and your experience dealing with him?
He was a gentleman. He was a very simple man, very committed to his trade, and very involved in his marriage with his wife. He was always willing to help people. As a matter of fact, when he came here to Wichita, he helped some small boxing clubs who were training little kids in the development of their boxing skills, and he dedicated time to that. He also took the time to form his own boxing club in here, and as a matter of fact, he have a gym developed here just for the help of people.
We know he went through a period where he had substance abuse problems. He was through with that by the time he passed away, as far as you're aware, right?
Yes.
And do you think that the media should stop reporting that he passed away of AIDS and stop saying that he had it when there is evidence to the contrary that he didn't have it? And also, according to the reports, the official reports, he did not pass away of AIDS.
Look at the media have to sell paper and news. And it's too bad that in order to do that, they have to present things in the way they are not. I'm sorry for those people. Those people have a hard burden to pay in their souls because they have been very dishonest many times. And the one who should have been honest and should have stopped down and say that is not true didn't do it.
Now, finally, did you receive any type of compensation or payment for doing this interview with me today?
$100,000? Of course not. I am doing this because I become a friend of Tommy. Tommy was a man who made friendships very easily. His wife is a wonderful woman who has kept that legacy.
Well, we really appreciate you coming on and helping set the record straight and get the real information out there.
And I really appreciate that somebody has taken the time to bring that to life because Tommy was a wonderful man, a wonderful person, a wonderful fighter. And they all trying to take that legacy away from him.
Thank you for watching the Hannibal TV. Please like this video if you enjoyed it and click the subscribe button to not miss any of